Alright guys, so welcome back. In this video we'll be discussing about the Huntington's disease, or this is also called as Huntington's chorea. So this Huntington's disease is also called as a neurodegenerative disorder of the basal ganglia. So this is a rare inherited disease that causes the progressive breakdown of degeneration of nerve cells. Basically in the basal ganglia it causes degeneration. It's also called as neurodegenerative disease. So this is progressively a brain disorder, this Huntington's chorea, which is caused by a single defective gene on the chromosome 4. So there is either any defect or mutation of the chromosome number 4. So this causes Huntington's chorea. So this was about the cause. Now we'll be discussing about at what age this starts. So this Huntington's chorea starts typically at the age of third or fourth decade, like if the patient is in 30s or in 40s. So this starts giving symptoms, and this results in progressive movement, thinking, cognitive disorders, and also many psychiatric symptoms are seen. So there are many symptoms which are correlated with any disorder of basal ganglia. So first we'll go with the pathophysiology. So this on the screen you can see that this is the basal ganglia. This is the normal basal ganglia structure, and we can also see the frontal horns of the lateral ventricles. So this is the normal anatomy of the basal ganglia. But what happens in Huntington's disease is that there is enlargement of the lateral ventricles, and this will actually push and this will cause neurodegeneration of the basal ganglia. So in the next slide I'll be discussing much more in detail that what happens to the basal ganglia. So if we see the healthy brain here, so the basal ganglia, we all know that it helps in smoothing, coordination, fine tuning of the movements. Okay, it helps in planning and programming of the movement. We all know this. So if there is any enlargement of the lateral horns, lateral ventricles, so this will compress, this will degenerate the basal ganglia, the dorsal stratum, and this will slowly and gradually there is degeneration of the parts of basal ganglia, especially the chordate nucleus and putamen. So once there is chordate nucleus and putamen degeneration, this will cause debilitating psychomotor symptoms. This will lead to many writhing, slow, choreiform movements, and these are the typical symptoms which are seen. Now let us see in this video. Okay, so this is the patient. He is having we can see slow writhing movement, we can see the choreiform movement, and there is also muscle dystonia. Okay, so one thing to diagnose here is about the time course. If suppose in this patient we can see the chorea time course, if it's chronic, if it is more than 1 year, okay, so this is actually a genetic cause related, and in adults if it's occurring, then this is Huntington's disease. So we can see here that this is a middle-aged man in around 30s 40s. So he's having involuntary jerking or writhing movements, that is the choreiform movements, and also we can see rigidity here. Okay, in his posture, in his rigidity, we can see muscular contracture, dystonia can be seen, and then there is slow or unusual eye movements. So we can see there is continuous movement of this, and whenever he is he has to perform something, his activity increases. So we can see this on his head, on his tongue, there is also some movements. On his eyes, we can see that there is slow or unusual eye movements. So one thing to very much important to distinguish this, many of the students have problem in distinguishing between a normal chorea patient and a Huntington's chorea patient. So in this case, what we are seeing here in this Huntington's disease patient, we have to notice the forehead. Now this forehead is having a movement here. Okay, we can see in this patient he is having movement there. Especially in Huntington's disease, there is movement of the forehead, and if we talk about the treatment here, actually there is no proper treatment, but though we can give medications. Now these medications can lessen some symptoms of movements and psychiatric disorders. Physiotherapy is of great help, and talk therapy is also very much important to support these patients. These patients need much more care, love. Okay, so this will help manage their symptoms. So this was all about Huntington's disease. I hope that this video was useful. Okay, thanks for watching guys.